I have actually been in that meeting. And then the question was, have you done your preclinical studies? And the answer was no. You've inadvertently given investors the wrong timeline and missed out on probably $1 million or more of work in the middle. Now you have to go back and say, by the way, we're not hitting that timeline and I need more money.
We assume regulation is just paperwork, but whether it's the FDA, the FTC, or OSHA, one missed rule can pause your roadmap and drain your runway. You might just think you're building an app or a simple tool, but the government might classify it as a medical device. And if you don't have a strategy, it's too late. I'm Avery Del Grasso, and welcome to Skills for Startups. Today, we are learning how to survive the knock at the door. On today's episode, I'm joined by Aaron Harmon. Aaron has worked in the biologics, drugs, and medical device industry for 20 years. He spends his free time researching the history of healthcare product regulations and shares this through his podcast, Regulations RX. He also educates and studies the impact of these regulations through Mount Marty University's Regulatory Science Master's Program. Welcome, Aaron. Thanks for joining me today.
Thank you. It's a pleasure to be here.
So, Aaron, today we're talking about regulated products and businesses. So, tell us a little bit more about what it means for a business to have a regulated product.
It's Big Brother is looking over your shoulder. But what it really boils down to is we have governments, and their job is to provide services for people. And sometimes those services look like ensuring that products that are produced provide the quality that they are purported or demonstrate to have. It boils down to if you're going to be the recipient of a pacemaker, and this is going to be implanted and be something that keeps you alive, you want some assurance that it is more than just a company overseeing this and that there's someone else that can look over, someone that's detached financially, someone that can kind of act on behalf of the users of those products or the patients. So if you're going to work in that environment, you work knowing you're going into a space where going to oversight. At the end, it's all for the same means. Companies most of the time are in the business to make products to help improve people's lives. I don't know of a single healthcare company that would say otherwise. And regulators are there to improve people's lives. And so it's a team effort and it's a long-term relationship, obviously, because those products that we produce tend to impact people for many years. So it's a long game, long relationship, and it's one where there's always another set of eyes making sure that things are being done correctly and providing some level of assurance.
So, I guess one of the first questions that kind of tends to come up is when you start a business or start creating a product, how can a founder know if their product is regulated and by what entity?
Wait until someone knocks at your door and then ask, who are you? And why are you here? Is that acceptable?
I feel like maybe then it's probably too late if you have someone
Probably is
knocking
too
on the
late.
door.
That's a tricky question. I think it's actually very hard to figure that out. I worked at a company for, I think, 7, 8 years before I discovered we had another regulatory body overseeing what we were doing. And it was the FTC in that case, the Federal Trade Commission. And it had to do with the export of products and technologies. We were a multinational company. And because we were within a company, it was easy to talk to other people in our business. And those other people were in other countries and didn't realize that some of the conversations we were having or could have been having would fall under FTC oversight of something called export controls. I felt for probably the first 7 years of that job that I was an expert and I was learning and knowing all the things I had to know. And then all of a sudden, here's a new regulatory body. There's kind of some obvious ones. So probably everyone knows about the IRS and they know if they're regulated by them because they have some kind of money transactions happening. So there's taxes involved. And then we have employees. So here comes OSHA knocking on the door. Does OSHA exist in this equation? It gets murky as you start to get into specific products because there is so many regulators. I think if you look at federal agencies and you look at the US government manual, the estimate is around 400 different agencies in the US. Now, of those, it's a narrow subset that have actual regulatory authority that impacts businesses. Some rules of thumb, if you make any kind of healthcare product or food, there's going to be FDA. This includes tobacco as well. The FDA regulates 25% of the marketed products or our GDP. So good chance if it is food, if it's a cosmetic, if it's a supplement, if it's a drug, if it's a vaccine or some kind of biological therapy, if it's a medical device, it would be under FDA. If you are working with insurance or healthcare, so if you have a nursing home, a hospital, a clinic, some kind of practice, dentist, then you start to fall under CMS. And then it gets a little trickier from there. And so there's offices within those agencies. If you get grants, there's some offices in NIH that have some oversight. They're very small administrative things, but there's some small regulatory efforts there. And if you get into working with biological hazards, so viruses, bacteria that can infect people, there's an individual, I believe he lived in Texas and had been arrested by the Fish and Wildlife Agency because of bringing in orchids. And so he ran into issues with a law on importing rare orchids and is commonly cited as a case of overregulation. But it was a scenario where I believe there was a level of unawareness of procedures and regulators in that case. So people run into that problem where someone knocks at the door and then they find out they're regulated. But most of the time, if you're in our field, that's going to be FDA and then probably a little bit of CMS.
I know you talked about the orchid example. Are there any stories or situations where you have a medical product company that didn't know maybe they were regulated by FDA? Does that happen?
Happens a lot. And it happens for numerous reasons. Just high level, one area that people run into trouble is apps for phones. Apps are easy to make. There's been a number of companies that have gone down that path of trying to create an app to help people that are suffering from depression or anxiety, and we're unaware that they're regulated products by FDA. The terms that are used to describe like a medical device can be quite broad. So it's anything like contrivance to cure, treat, mitigate disease, to alter the structure or function of the body. So it's so broad of definition. And then the descriptions around what constitutes a medical device is essentially anything unless it's a drug. And so because of that, software falls under medical device, and making an app to help someone suffering with anxiety of going back to school can suddenly look like a medical device to the FDA, and you would fall under FDA regulation. So it's easy to run into that where if you aren't proactive, you're really focused in on like the research or the product development, and you aren't aware because of a lack of prior experience in that field. A lot of these things aren't trained in high or in colleges. So you can come out of an engineering program and you probably haven't had a whole lot of training in working with regulators and what regulatory bodies oversee your products.
Yeah. If I could drill into that just a little bit more, in your opinion, what might be the best way for a startup founder who's unaware to start being proactive? How can they start doing that?
Yeah, probably the easiest way to do it is to, if you know the direction. So let's say your direction is something that would be FDA. Let's say you're going to college and something you're really interested in is improving prosthetic limbs. Like that's an area you're really excited about. It's FDA. And for that broad reason I mentioned earlier. But if you have an inkling that this is the space you want to go into and you're interested in the regulatory side of it, FDA has a lot of good educational material. So it ranges from podcasts, they have a YouTube channel, and then within each office, so the FDA divides the task of regulating all of that. So if you go to those sites, they provide a lot of good educational content. And if you just go to that content, you can learn quite a bit without having to spend any money on consultants or education. So there's an immediate access gateway for those that are curious. And then as more questions come up, then you either start to point the direction of experienced professionals you can reach out to, the agencies themselves you could reach out to, or you get to the consultant space.
Yeah. Those sound like some great useful resources, and they're all free, right?
Exactly. Free is good.
So, absolutely. Especially in the startup space.
As for cash is king, cash is probably always king.
Well, speaking of cash, so in this space, obviously people can DIY and start to learn things by themselves and, go through these free resources. In terms of spending, let's say early investment dollars or early capital for a startup with limited time and resources, what's the most efficient way to spend those From a regulatory standpoint, what's the most efficient way?
I used to think that was an easy answer, or maybe an easy question. I don't know anymore. First, let's look at two approaches. Approach number one, you wait until like the last minute. So you've raised money, you know you have to get into clinical trials. And now it's like time to figure out, okay, we're planning to be in trials in like 6 months. And so we better get some consultants to support us. We have some dollars, grants have come in, investors have put money in. Let's go do it. I have actually been in that meeting where I've heard that play out. And then the next question was, okay, have you done your preclinical studies? And the answer was no, we haven't done that yet. Well, when it comes to drugs, preclinical studies, there's a whole battery that you have to do. And odds are, when you're making these decisions and these statements about being in trials in 6 months, it has involved you communicating these to investors. And you've inadvertently given them the wrong timeline and missed out on probably $1 million or more of work in the middle. So now you have to go back and say, by the way, we're not hitting that timeline and I need more money. And there's more risk because we haven't done all these preclinicals. That's a bad scenario. Now
That
let's say
sounds like a tough spot to be in.
it'd be not good. On the other side of it, let's say you go out the gate early and you go heavy on the regulatory and quality. One, you don't know if the product's going to even work. You haven't been to proof of concept yet. And so you're spending dollars on people to advise you on downstream things, but they can't grasp the project or the product at that point because it hasn't been developed. And there's a ton of risks that it won't even work. And if you spend those dollars on getting really good upfront advice and not putting those dollars into the R&D to make the product feasible, then you're kind of shooting yourself in the foot again. So it's probably more like when a sports team has a salary cap and they have to pick players and figure out how to spend those dollars on who. Where you know where you're good, you know where you're weak. Maybe so I think it's a challenge of like knowing what that product is and the unique properties of that product. I feel like it really takes someone having the insight on the team of what the team's strengths, weaknesses are, what the regulatory burden is going to look like, and maybe even doing some short little stints with the consultant just to make sure to fact check maybe some of the early assumptions in that model. So that's an ambiguous answer, which is very typical for regulatory folks. It's just hard to say until you hire us and let us dive deeper.
So we talked a little bit about learning more about the regulatory environment and how to learn more about your own regulatory situation. Can you tell me a little bit more about what a regulatory strategy is and what goes into that?
And I don't know that I've perfected this one yet, but let me take a stab at it. The first time I really came head to head with the regulatory strategy, I was working with a startup company and they had been working with the consultant. They'd had some FDA interactions. And in trying to get my head around the project, I began thinking of what is the next step. And it didn't cross my mind to formulate that into paper yet. And then I was in my next role and was talking to someone who's an investor, and they asked, well, why aren't you taking this product to Europe first? That was the question they asked. And my answer was, well, that's not our plan. I can't tell you a whole lot about the plan right now because I'm still new in the job and I'm trying to learn it. But I thought in the back of my head, there seems to be a miscommunication between people in the organization. So you have people on the board, and the board was asking questions. And if they're asking questions at that level, that means they must have not, at that point, really understood what the whole strategy of the companies was around regulations. And that got me thinking, boy, we should put this on paper and lay out what is our plan and get to a point where we could look at something on paper and know that everyone is in alignment. At least they know this is the written plan. And then if we're asked, well, this is our written plan. And if everyone in the organization knows it, they wouldn't even have to ask because they would know at any given time what that plan was. The follow-up question then was, well, what goes into a regulatory strategy? So I hop on Google and I Google regulatory strategy templates. I then read a number of forums online and ended up with something that was like, product description, product classification, regulatory pathways, or like which regulators were we going to work with and what countries do we want to launch in and what was the timing of those launches. What are all the regulations that impact this product? And then like what are the submission plans? Like at what time and maybe per quarter and year do you plan to make this submission? So I began with that and I went through pretty meticulously, laying all that information out. At the end, it made a lot of sense. And I felt like, yeah, this is a good strategy. And it held up, like that model held up for quite a while. It served me well. You can begin to just list it out on paper, make a plan. Everyone's agreeing with it. It has your timelines on there. It all interblends. And I would add, it has to also mesh with the rest of your business plans. So if your marketing plan is not for the countries you're registering in, you got a problem. If your patents don't match the countries that you've got plans to launch in, that could be a problem. If the language of all of your labels and content doesn't match the languages of where you're going, that's a problem. So it has to be an integrated part in many different strategies within the organization.
It sounds like putting your regulatory strategy on paper and getting organization agreement between all of your teams is an important step. What benefits might come of that, or what positives have you seen from that?
What's the saying? Those that fail to plan to fail. I think it's easy to have stuff in our head, but I am a victim of failing whenever someone asks me, what did we have for dinner last night? No matter how good that meal was, most of the time I have to really think, and it takes a lot of effort to recall what meal I had the previous night and what clothes I wore the previous day. To have detail and resolution and fidelity in those ideas after time tends to fade. And in an organization, I think it's the same problem where you can have great ideas. You can walk out of a meeting and say, yes, all of us are on the same page. We're all aligned. You walk out of that meeting and you face a whole bunch of other decisions to make. You face more emails, phone calls, meetings, technical challenges in actual company operations. And a week later, there's another meeting. A week later, there's another meeting. And 6 months later, you find yourself rehashing everything you discussed because it wasn't written down. And people forgot, people had mixed in other memories. And it's like you're scratching something in the sand and the wind's always blowing. And when you come back, it's going to be, maybe there's some faint outlines of what was said, what was written down, but it's gone. And so FDA in the device space, they define the word established. And in that word established, it means that a plan has been made, has been documented in writing or electronically, and it is implemented. And implemented means evidence. So there's some documented proof that's implementing and having evidence of what you've done. And that's true for businesses. So if you don't establish something, then you don't have anything at the end of the day. So get it in writing and then have some proof you have it in writing. And then there you go.
So, as a startup founder, where can I find help if I need to get started on my regulatory strategy, for example? What tools are available?
I think it goes back to that first question you asked, though. So there's two ways of looking at product development. Maybe there's more, but two that come to mind. One is technology centered, and the other one is disease condition centered. So let's say your approach is technology centered. And that is, you were in a lab one day, you were working with cell lines, and you accidentally mixed this new chemical into your cell culture media, and you noticed all of your cancer cells died. And you thought, shoot, what did I put in there? And you found out that someone else in your lab, they stuck in, and none of them died. And those are just healthy, normal cells. So you say, wait a second, the cancer cell lines died, the healthy cells lived. This chemical seems to selectively kill off the cancerous cells. And then you have that moment of, geez, I just found something huge. This is really big. And you get excited about it. And okay, what cancer cells does it kill? And so you begin thinking about all the possibilities, and you find out it kills lots of different cancer cells. And suddenly you're like off to the races. And then finally you've got something, you do a trial, you see if it works, and if it does, you're trying to get approval on that product. The other way to develop a product, though, is the approach where you say, I want to make an impact in a space. I had a loved one die of cancer. I have a lot of money, and I want to apply this to making a difference for others so they don't have to go through what I went through. So, where is the biggest need right now in cancer? Is it cancer treatment? Is it in preventions? Is it in cancer awareness? Maybe it's diagnostics. And suddenly that looks very, very different because now you're thinking about, well, which cancer? Is it something that is in other countries? And is it something in other populations? And it's so broad that I think at that stage you really need a lot of regulatory thought too into this. Where that other model, it keeps getting narrowed and narrowed and narrowed and narrowed, and you're like, okay, I only have one pathway, and it's going to be a breakthrough therapy because it's this, and that is so narrow that the amount of regulatory input really centers on clinical trials, but you have a very broad plate because it could go so many directions. And so I think that's the two dynamics you're trying to deal with. And most entrepreneurs are in the first category. They've discovered something. They aren't in the space of like broad, like maybe I want a preventive because they're already normally so far down.
Do you have any final thoughts or wisdom to impart with us today?
I want to go a different direction on you in the world of regulatory. And let's change it from regulatory to change it to medicine. So we'll talk about medicine instead. If you get ill, you go and see a physician. Now, that statement is true, but also not always true because you have other options. So you get ill, and what we do now is we Google things. And maybe we Google it and we try to see what it comes back with. And there's some websites that help. And then maybe we try to apply some of these treatments first. And then maybe we at some point do a ask a nurse line. I've done this before in the past where I call up the ask a nurse, like, should I go in or not? I've got, XYZ happening. And then eventually they're like, yeah, maybe you need to go in. And then I go in and I walk into the ER and I see like a triage nurse. The triage nurse says, okay, yeah, you're going to go back here. So I go back in there, and then it isn't the doctor that goes sweeping in. It's someone there to register me. And then it's not the doctor that comes in. It's someone else that comes in and they're doing something. And it's another person. And then maybe like 5 people in this equation finally emerges the doctor. Now, is the Google search useful in this healthcare process? And yeah, it probably helps a lot of people. I don't know if I had the most success with it, but I think everybody at this point in our country and if not the world has tried it. And I think this is also holds true of regulatory. So you mentioned consultants, and I am assuming there's going to be some change in the regulatory world. And what I mean by that is the thing that constitutes a consultant is they have some experience. And what I was describing to you was practical tools. Like you go on the FDA's website and you find these training videos, and you can watch these training videos, and you can find FDA guidance documents and you can read those, and you can go into the codified federal regulations and you can read those. But that's not why people pay consultants. They don't pay them to read things. What they're paying for is some kind of other insight. And the way I think about it is our country is made of we have a constitution, and then on top of that, we have laws. And then on top of those, we have regulations. And then on top of that, we have policies, which we call guidance documents with FDA. And then there is something on top of that, and that is unwritten social norms. And FDA operates by unwritten social norms as well. Right. And so that's the things like, can you call the FDA up and ask them about this? Well, that's a huge unwritten social norm. I gave you an example about a conference I was at, and I had learned about this 9-day regulatory reliance with TGA and the EU. That's not written anywhere. I only know about that because I went to that conference. I heard that conversation. And at that same conference, I sat with somebody who worked in the industry standards section of FDA that oversees standards and the application of standards to products. And so I have lunch with them. I talk with them and I get more insight. I learn things that aren't written and maybe aren't even Google searchable. I've had some where I've been in the meetings with them and I realized they didn't understand basic principles of FDA. They maybe had worked at a few companies, like, oh, yeah, I've been doing this. I know what to do. But they didn't have any formal training. We have people that do the apprenticeship. We have people that are consultants. And when you ask, oh, yeah, I worked at this company. I was in Medtronic for 20 years in the regulatory affairs department. I submitted, X amount of these applications. Did they have formal training in it? And the answer could easily be no. But they had so much experience that that's what makes them a regulatory professional now. And then we have 24 programs in the United States that offer master's degrees in regulatory science, and they've got formal training in there. And then most of the time they end up in a job where they are doing an internship or some kind of training. And that starts to mirror what we do in modern medicine now. So, and then we also have the Regulatory Affairs Professional Society RAPS, which does certifications. And so you can then get like a RAPS certification. You can use that to show that you are a certified professional. So I think the industry is moving that direction. And so in some of those early things where we're like, you can hear how does an entrepreneur start up? It's kind of like how does a person get treated in the healthcare system? And for a lot of entrepreneurs, they start with Google and they're Googling how to fix their problem and who the regulators are. And they're going to the sites and trying to learn information, and all that's good. I think that's it's a crucial first step. But I think on the regulatory affairs side of things, we need to continue to migrate our industry to where you get at the end of the day that top of the line professional, because your whole business strategy may fall in this. And if that's such an integrated part into your business, I'm in the education space, and that's our job, is to create those professionals that can come out and be that end all, that physician level person that helps treat, or in this case, help a business succeed, capture the markets, get the cash flow coming in, and ultimately get good products help people.
The Skills for Startups podcast is offering a free guide on customer discovery. Download yours today at skillsforstartups.com. Skills for Startups is part of the Prescription Podcasts family of podcasts. To listen to more interesting stories, including those that are shaping the future of our health, visit prescriptionpodcasts.com.